September is Prostate Cancer Awareness Month, and joining me today is Dr. B of the Prostate Cancer Institute of Arizona and urologist Dr. Patel, who is with the affiliated urologist. Did I say it right?
That's right.
There it is. How are you two doing today?
We're doing great.
So this is a very important topic, important topic to a lot of people, especially you, doctor. But let's first talk about the type of doctors you are, because you're a urologist and you're a
radiation oncologist.
Okay, and the difference there is a little bit is what?
So for urologists, we are a surgical subspecialty. We are surgeons that focus mostly on the urinary tract for both men and women. That includes kidneys, bladders, prostates, really anything men's health, and most people don't know, but women as well.
Yeah, and then doctor?
As radiation oncologists, we are doctors who specialize in the use of using radiation therapy to treat people's cancers.
Yeah.
And as you know, I specialize only prostate cancer now.
Right, and it's a great technology that you use there, and this is something important, especially this month. We really need to talk about it. And let's talk about your story, because this is very pretty much hitting home for you, isn't it?
Yeah, it is. So I think I got into medicine not knowing what I wanted to do, and I thought I wanted to be a trauma surgeon, but I fell into urology as my dad ended up getting prostate cancer, and he was young. He was 48 when he got it, and unfortunately passed away at 50. And that was kind of my passion and my drive to go into urology. And even to this day, every time I talk about prostate cancer or someone with prostate cancer, I still get the chills today, but that was my drive.
Drive there. So let's talk about the things that we as men need to do with, of course, Prostate Cancer Awareness Month, just prostate in general. What's some things we should be looking for, paying attention to? The
biggest thing is, you have to have a primary care doctor, and once you see them, you got to get screened. You have to get screening for prostate cancer, and it's as simple as just getting a blood test and seeing your doctor.
Yeah, and Dr. B, what's very important too is after you have been diagnosed, is seeing someone like you, and that's where you actually work with a lot of doctors around here in the Valley, don't you?
Yes, I really enjoy collaborating with urologists such as Dr. Patel. I think having a team approach for patients is really best. Prostate cancer is very different than other cancers and unique in the fact that there's multiple options with excellent cure rates. And so it's not easy to figure out which one is best for you. It actually gets complicated for the patients, and that's why having a team approach really helps them.
Yeah. Doctor, as we talk about having a team approach and working so maybe before they're diagnosed, is there things that we need to look in our bodies, and seeing what's going on, to make sure that we are, of course, as we say, using the bathroom the right way?
Yeah, see, the interesting thing about prostate cancer is that it really has no symptoms. So people think that, if I'm going to the bathroom more, if I have these urinary symptoms, then you're worried about prostate cancer, but that's really not the case. So screening and seeing your physician and having a urologist once you turn 50 is probably the best option to kind of get screened.
Yeah, and then after, of course, being diagnosed, you will come see Dr. B, who will there help you. And with your surgery, and then that's really surgery, do we call it surgery, or is it more of a procedure? So, which is so important here, and that is where, again, it's something that has a great success rate. It's also, too, something that has been around for a long time, but you're really bringing back in it to take care of men so they can get back to their everyday life, right?
Yeah, it's one of the treatment options for prostate cancer, and just recently hasn't really been offered that much since it hasn't been available. So yes, this has been my passion now to help revive this modality so patients now have this option. And yes, like you said, it's a great option since there's minimal downtime with successful cure rates and can maintain your potency.
Yeah, very important. We're so happy that you're part of our Live Well program too, which is so important, especially during this month, Prostate Cancer Awareness Month. Any tips on, of course, you have for us to make sure that we are getting the right health screenings that we need to?
Yeah, so when the recommendation is when you turn 45 to 50, the most important thing is shared decision making, is what our society calls to sit down with your doctor and kind of decide whether it's the right thing for you or not. Because getting screened does bring along procedures and anxiety if you do get diagnosed, et cetera. But I think the most important thing is to figure out how to stay healthy. So I would recommend just going to see your doctor and kind of figure out if that's the right thing. But starting at the age of 45, for most men, if you have a family history or high risk factors such as a young parent like mine, or African American, and if you have high risk factors, you should go earlier than 45 at the age of 40.
There it is. And again, doctor, for all you do and everything, love having you in here, and again, helping people get back to their regular lives. And I will say this, gentlemen, Gentlemen, have the talk with your friends. It's okay. It's time to start talking about this so we can prevent it and also we can get it taken care of when you do have it. So thank you two very much. And if you want more information of Dr. B and Dr. Patel, you can head over to our Live Well page on aztv.com.